continuing, we have the transducer oriented to his to his right shoulder, sorry. We rotate the transducer clockwise towards the left shoulder, and we try to keep the aortic valve in our field of view, so you can tilt and during turning a little bit, but be aware that you do not tilt too much, because otherwise you will simply lose the image. It doesn't matter that much when you're used to echocardiography. Of course, you can also start at the midventricular or the mitral valve view, but initially I personally want to see the aortic valve, and in this case the aortic valve seems to be okay, but it's relatively hard to see. For another atypical view, we have to rotate the transducer a little bit more towards the left side of the patient and tilt the transducer upwards to see the pulmonic trunk again. And here we do see the pulmonic trunk, and we also can activate the pulsed wave Doppler to measure. Here we have a measurement of the RVOT outflow, so the right ventricular tract outflow, and we can measure the RV, of course, how the outflow is happening, how is the signal normal, but we can also measure a so-called pulmonary acceleration time, so the time from the beginning to the maximal flow, to see if there is a likelihood of pulmonary hypertension. Then we continue with the area of the mitral valve, where we do see again here the anterior and the posterior mitral valve leaflet, and we also see that the mitral valve, the anterior leaflet, at least parts of the chordae tendineae, are moving towards the LVOT. This is a so-called SAM, a chordal SAM in this case, because we do not know if there's real obstruction present or not. So we can also use color Doppler to see if there's elevation in the flow, and we also can use M-mode. M-mode is a rather old measurement, but still we can see that there is at least chordal SAM present. But we have to continue with our overall evaluation of the heart. We can also try, just for demonstration purposes, to go back and use the M-mode also in this area, because the M-mode simply shows the structures over time, and here there is this SAM phenomenon present. But be aware that a chordal SAM, or really the LVOT obstruction, it doesn't really matter. So the M-mode just depicts the structures you see. So that's the mitral valve, the opening, and then you have this pulled motion from the chordae tendineae towards, here was probably the best signals, towards the LVOT. Then continuing, we have now the mitral valve. We continue towards the papillary muscles. We have here the papillary muscles, the posterior medial and the anterolateral papillary muscles over here, and then we can even tilt downwards until the apex. We do also see the right ventricle over here.